closely connected. Just again, welcome everyone to the Black Man Lab. Normally we do this every Monday at the Young YMCA on Campbellton Road, but because of COVID-19, we're having to make these adjustments to make sure everybody stays safe. I have with me co-facilitator, my brother from another mother, Marty Monaghan from the south side of Chicago. Marty, how you doing?
Hey, welcome to the Black Man Lab, everybody. Glad to have you tuning in to our Facebook Live as well as our YouTube Live. So welcome here.
This is the first. We're doing this Facebook Live thing, trying to, connect with more of our folks. We have an incredibly diverse panel of Black men who will discuss this subject, this issue around the death rate of Black people as it relates to COVID-19, the coronavirus. And so we want to start, though, we start always giving honor to our ancestors and just recognizing whose shoulders we stand on. And for that, we have our brother, one of the co-founders of Black Man Lab, one of the brothers of Let Us Make Man, and he can tell you about all of his other affiliations. I won't do all of that, but we got my brother, Professor Jared Grant, in the political science department over at Clark Atlanta University. So, Brother Jared, you want to bring honor the ancestors?
Absolutely. As always, Molly, we honor our ancestors typically at the beginning of any event. We like to, in Black Man Lab, to pay homage to those who went before us, those who did great things before us, and those inside of our own lineage, in our own family lineage, that we also like to just remember. And especially at this time, they provided us with a blueprint of success, and we just want to take a moment to think about them. So right now, think about some of our ancestors that did some great things: Martin Luther King, Malcolm X, the list goes on. So take a moment and just think about some of them. And now raise your fist up and everybody say Ashe. Ashe. All right. Now in your own family, think about some family members who transitioned, and let's honor them. And
hey guys.
Hello.
How you doing?
Good. Let's honor them in that tradition, and let's think about those ancestors from our own lineage. So let's take a moment to think about people in your own line and the memory of them. Now raise your fist up and everybody say Ashe.
Ashe.
Ashe. Oh, thank you.
So we want to bring in also an opportunity for us to take a moment. We have two brothers who've been close to the work of Black Man Lab who have been ill. We have Brother Ryan Cameron, who many of you all know, received an award from Let Us Make Man. What folks don't know is that in our first iterations of Black Man Lab, Ryan would come over to Sankofa Church and sit with the brothers and give insight. And so we are just really praying for Ryan, praying for his full recovery. So we want to lift up Ryan. And then we have Brother Bashir. Brother Bashir has been very engaged with Black Man Lab, trying to work with brothers behind the walls who have been incarcerated. And right now we got word that he is in Southern Regional fighting against this COVID-19. So we was praying that he's able to gain his strength and overcome this. So we just want to lift up those two brothers who have been supportive of Black Man Lab and a part of our circle. So we just want to lift them up. So we want to jump right in to our guests. I want to start with Congressman Hank Johnson. Congressman Johnson, how are you? And it's good to see you. Glad you are back from DC. And just wanted, we've had this conversation about how COVID-19 and the death rate for African Americans is disproportionate. And we just wanted to have a conversation about that, and wanted you to just talk a little bit about what your experience has been in DC, the efforts that you've tried to make along with other folks to address what's happening in our communities, and what way you see us moving forward. If you could give us a few minutes, and then we'll go to Brother Dr. Ricky Jones from University of Louisville.
Okay, well, thank you, Brother Mawale, and I'm very happy and honored to be on your program tonight, along with the other men of Black Man Lab, particularly Brother Grant from CAU, my alma mater. I'm happy to have a product of the Washington, D.C. school system, public schools, then came to Clark Atlanta, then known as Clark College, to matriculate with a degree in political science, whereupon I then headed on to Thurgood Marshall School of Law down at Texas Southern University, another HBCU, and obtained my JD degree there, and then practiced law for about 27 years before I went to Congress doing criminal defense work. And so a boy from Washington, D.C. through the public schools, going up through the HBCU system, and then landing in Congress has presented me with a unique experience to bring to bear with my job. And so it's from that vantage point that I act as a congressman. And I'll tell you, health disparities in our country is something that we have long known about. I mean, it's a clear fact. Studies have shown, we do worse in terms of our health care. Our death rate among our people is high. It's, in other words, white folks live longer than Black folks by several years. And that's due to a legacy of systemic and systematic racism in our country. And that systematic racism and systemic racism has reared its ugly head with respect to the disproportionate numbers of Blacks who are dying from the COVID-19 coronavirus. I mean, just shocking statistics as far as the disproportionality of the deaths of Black people due to this virus. And a lot of it has to do with the inherent racial bias that is in the medical care system. And so in other words, studies have shown that when Black folks present to a hospital or to a doctor's office complaining of pain, then they are given pain medication at much reduced rates when compared to white folks. And so this racism in the medical care system is well documented. So here we come with the COVID-19 coronavirus pandemic in America. And with us suffering from the kinds of diseases that compromise the immune system, with us having high rates of heart disease, lung disease, asthma, diabetes, kidney disease, and the like, high blood pressure, there's no difference in terms of our disproportionality of dying with COVID-19 because of our immune systems being compromised. Now, these immune systems are compromised by a lot of factors. One, when we talk about folks presenting to the medical care system for help and there being inherent racial bias in that, we also are disproportionately locked out of the healthcare system because we lack insurance. And so therefore, many of us end up developing chronic conditions that we seek help for only when they get to the point where we have to go to the emergency room. And then things are so bad with our condition that it's hard to bring us back to 100%. So we end up walking around with susceptibility to coronaviruses such as COVID-19. So if we do have health insurance, we're also, in terms of where we live historically, our housing has been situated, our communities have been situated in areas of environmental degradation. Environmental racism plays a part. So when it comes to things like high rates of asthma, because we're living near industrial polluting plants, we're living near landfills, we're living near waste treatment facilities and the like. This has caused many of us to be compromised in terms of our immune systems. And so we present to the COVID-19 situation with a legacy of racism that displays itself vividly to America in the form of these statistics in terms of who's dying from COVID-19. And only a blind person would be unable to see that something is wrong and that we need to take some measures to correct it.
Thank you, Congressman. We appreciate you. We're gonna circle back to you. Please stay in the conversation with us. I wanna turn to Dr. Ricky Jones out of the University of Louisville, the Pan-African Studies Department. Rick, can you share your perspective? Congressman Johnson has given us and shared some historical context. And the reality of prior to COVID-19 that we had health disparities that existed already. Put it into some political context as well, Rick, and then if we could have Brother Lewis on deck to talk about the work that he's doing directly in the community and how it has been what he's seen in the street serving. He's been serving people food. So, Rick, we want to pivot to you, brother. Dr. Ricky Jones from the University of Louisville.
Yeah, and I don't want people to think that I'm just a Louisville kid. I'm actually an Atlanta kid, and since Brother Johnson wanted to talk about Clark, Atlanta, graduate of Morehouse College, Mighty Morehouse, class of '92, from Southwest Atlanta, the old Carver Homes Housing Project. So it's good to hang out with my friend Mauli. My first year of college, we were together at the U.S. Naval Academy, so it's always good to see you, Marty, and all the other brothers. I don't want to belabor the point and take too long because I want to make room for all the other very serious guests who are on this show talking about an important topic. I think Congressman Johnson did a very good job of putting this into context when you talk about the health disparities that Black people are facing. But really, we're facing disparities across the board, literally from the cradle to the grave. We see higher rates of infant mortality among Black people, but Black people also die sooner. We're seeing higher stress rates. We're seeing disproportionate incarceration among Black people. These stress rates have all kinds of physical and mental factors with us. But what this is really doing, I think, Mauli, is showing us once again, and people like us know, that I'm hoping that people are watching this, and this isn't just preaching to the choir. What we understand once again is that racism is really a long-standing global pandemic and a long-standing national pandemic in America that socially, economically, psychologically, spiritually, and physically has destroyed millions upon millions of Black people. And it is still alive and well. So for me, when you look at the hard data, from Illinois to Maryland, to New York, to Louisiana, to Georgia, all over the country, every place in between and beyond, you see incredible disparities in this particular instance where Black people are dying from this affliction. In St. Louis, the number came out a few days ago from Newsweek. They reported that every single COVID-19 death in the city of St. Louis was Black. I mean, that is a daunting reality that we're facing, that every person in that city that's died from COVID-19, is African-American. So the question is, not just what we're going to do about the coronavirus, but you all are certainly trying to do this with Black Man Lab. All of us are doing it in different spaces. How can we come together as tribunes and proselytizers for our people and figure out ways that we can face a system of entrenched racism that's still beating our people down? And so we got to unify across lines of class on that, because if we don't, we're going to continue to see our people being crushed by this and other factors consistently, even once a vaccine is found for COVID-19. So that's very important. With that, I'll yield to the rest of the guests.
Thank you so much, Rick. Appreciate the insight and keeping us on the forefront of understanding that institutional racism has been a stalwart in keeping us, up. So thank you so much. With that, I'm going to bring on Brother Keith Lewis, who has been on the front lines and is actually seeing people where they're at, bringing food to people and helping out in the communities on a real grassroots level. Keith, can you jump in and give us your feedback?
Oh yeah, good evening, gentlemen. How's everybody doing?
Good, bro.
That's good. That's good. Yeah. So basically, my organization, I'm a Father First. Me and Jermaine Clark, we've been out in the past 3 weeks now. This is week 3. We've been feeding families. We're partnered with Atlanta Public Schools, so we're getting our families from APS. We're getting them from principals at Gene Childs Young, Best Academy, Douglas High School, Crawford Long Middle School, and Sylvan Middle School. So all in the middle of the city. And I mean, we're just seeing people really living in destitute situations, to be honest with you. And like they said, this is something that we struggle with well before coronavirus. So it's just, I think now, due to the fact that people are going to feel it on both sides due to deaths, and that it's going to cross over those social and economical barriers as far as the divide between mind frames. I think a lot of people are going to feel the same pain right now. So it's just going to really make it a more open conversation for us. I've been getting an outpouring of support from people that don't look like us, to be honest with you. And they want to see us help our people. And in this time, I can't really look at it from any other theory other than that's what they want to see. So we're just in the ground. We just got back. Me and Jermaine just got through feeding. We delivered 20 families again today. We delivered 20 families dinner on Easter Sunday. The average family is about 6 to 9 children. And, one mother around the corner has 12 grandkids living with her, or it's 12 in the house total. So when you're talking about people making under $25,000 a year, some completely unemployed, so that number doesn't even matter. And you're talking about multiple children having to stay in the house all day, all types of things are going to arise. So when you talk about deaths, when my partner just called us and said, we're going to get out when everybody out. When you're in the hood, they out, y'all. They not in the house in the hood. We just left Campbellton and they are out. So the thing is, it's going to take manpower to really help sustain our community. We want people to help us. But the reality of it is, a person in a house with 12 kids making under 20,000, they outside, guys. They not sitting in the house waiting on somebody to come save them. They moving around like it's a regular day because they still got to have regular stuff to get handled. So I think for us, what we need on our end, front line, we need resources like Brother Parham said the other day. But even on that, once you get in the game, it's moving fast. You know what I'm saying? It's like when you're playing in the middle of a game, you got to be able to know all the parts you need. So in order for us to stabilize communities, I would say we have to identify the communities, which we can help with that are really underserved and in these really tight pockets. Like we're feeding a lady from South Atlanta who lost her daughter in December to a straight bullet went in their house. And the mother literally goes to the grave site every single day. She don't care about Corona. She's still going to the grave site because she's mourning her daughter who just passed 4 months ago. So right now, I would say all the different levels of conversation, they got to happen, and they got to happen fast. Because come May, June, we're going to see a whole nother thing. And then when them checks hit, guys, I'm going to say this and I'm going to be gone. When them checks hit, the same person that's waiting on income tax, they waiting on that stimulus and they not practicing any social distancing. They gonna be out there like it's a holiday, guys. So I hope you understand the disparity in the mind frame of a person right now, man. They not hearing the effects because all they know is they live this every day.
Mm-hmm. Yeah, it's interesting. And one of the things that I was thinking about, Keith, is those people that are under those conditions are also probably not prepared in terms of equipment, right? the PPE that a lot of us are able to utilize when we go out in public, that's not in those communities.
Hey man, masks, we need masks so bad. When I tell you, I have recycled my mask the past 2 days. And when I tell you, you go in the hood, but these boys still got their pants hanging off their butt, they still smoking in the streets, and they still trapping and talking crazy like nothing is going on. Mm-hmm. So before we're fighting for everyone, we need to find the people that actually want to win the fight, and we need a strategy. Because there's a lot of them that don't care if they are pawn in the game or not. They just know they living to die anyway. One thing Dr. Karstoffen told me when she gave us that grant last week is she's always believed that she's seen people are born to die in poverty. That's a real mind frame that people have, where it's not about what our ancestors, no disrespect, did. It ain't about what mama, granddad, dad did. It's about that person right here. He is doing whatever caused it. But people are literally breaking the chain that we say we're not breaking links in right now by their everyday actions. I talk to people at home, but they have no idea what's going on out here. And it's going to be all types of stuff from chemtrails to 5G towers to robberies and murders and carjackings that's going to be happening due to this coronavirus. And come June, you're going to see a whole nother city. And I'm just being for real with y'all guys.
Man, Keith, we appreciate you, brother. We appreciate you, man.
Thank you, guys. Thank you.
No doubt, continue to support the effort. Those masks, man, we purchased masks. It was $10 a pop for N95. So there are people who are getting rich off of selling the mask. So that's a reality of, so when we talk about people not having PPE, I mean, you got to make some folks are making life decisions. Do they buy a mask or do they get food? And those decisions. So we appreciate what you all are doing, man. Tell Brother Jermaine we said what's happening. Hang in, Keith. We're going to keep rocking. There he is. What's up, fam?
Hey, what's up, brothers?
Right. Brother Todd.
Want to bring in Dr. Williams, Dr. Pee Wee Williams, one of our brothers. Another, he's in Macon, but he's really a Atlanta native, from Atlanta. Come on in, Doc, and talk about it from a health and public policy standpoint. Come on, we can't hear you. Got to unmute. There you go. Kevin
Okay.
Pee Wee Williams. What's up, brother?
What's going on, brother? Yeah,
Good.
I agree with the rest of the panelists. It's definitely systemic racism. Let's be very clear. It trickles down to, and I'm not going to repeat all of the things that people were saying, but definitely self-determinants of health is something we look at from a public health perspective. And one of the things that concerned me pretty quick off the bat was I originally figured with our health history that we were going to be dying more than others when the outbreak broke out. And I'm concerned with the lack of data that has been collected via race. It took 2 months for it to kind of trickle out of certain states and cities that were collecting data, so we can actually really see how serious this problem was in our community. So from a public health perspective, as a brother was just talking about, we need to figure out what are the immediate needs of our population, and good data collection is going to help with that. Where can we fill in the gaps with our organizations, churches, nonprofits? Where can we fill in the gap? And then from a policy perspective, how do we continue to keep the pressure on to make sure that the data is collected, make sure that we're getting the proper equipment in our communities? I've been looking at a lot of the presentations that are being made at both the state and local and federal levels. And I like the fact that now people are pressing our politicians to what are they going to do, or what are they going to do in terms of collecting data and looking at the impact it's having on our communities. We have to keep the pressure up because we don't have good data as it is broken down by race. It's just now starting to trickle in. And so that, go ahead.
Give the folks that are viewing this around the country, give them some context about your background and what you do. We know you're a professor in Macon, but just give some context as to what you do, what your focus has been.
Okay, so I did my undergrad at Florida A&M University in criminal justice with a minor in sociology, and did my master's in public health in their first inaugural class in health policy administration at Morehouse School of Medicine. I was in the first class there, and I worked under Dr. Reuben Warren, who's over the Bioethics Center for Healthcare at Tuskegee University. And so I've done a lot of research with him. I worked with him in the Office of Minority Health, and I did my PhD at the University of Georgia in education and health policy. So my background has been health policy, looking at minority health in particular and health disparities. So that's kind of the context and what my experience working with the National Center for Health Statistics was. And I was there when Dr. David Satcher was over the CDC. Collecting the data about the disparities is a critical part in helping to address things from a policy perspective. And, as important as the census is, filling out the census and trying to get resources to our community, it's also important to figure out what the data is so we can press the policy decision makers into giving us the type of resources that we need in our communities. And I mean, it can start at the local level. I mean, just knowing what neighborhoods need what is part of what I'm talking about. Ground up data collection.
And Brother Fred Parham, Brother Fred works with a number of organizations that are directly in the community trying to provide resources. Brother Fred, what are you seeing in our communities, and what resources are you able to bring forward and just share with people who are watching and who may watch this later on as a recording?
Yeah, thanks, Brother Miley, for tossing me the microphone. Well, essentially working with Brothers Keith and 100 Black Men of Atlanta and at the At Promise Center over in the Bluff, not too far from Douglas High School. It's pretty much what Keith explained, and I think it's varying degrees on the spectrum of impact. But I would also caution us to even consider teachers, law enforcement officers who have 2 to 3 kids in the home have now reached a point where they are in these lines. Some of my colleagues as educators, are looking for places where they can respectfully go and get some support for food. So I think the impact is not just felt, in our lower income communities, but also is surging toward the would-be middle class. And so, but for me, in working with the organizations I work with, I'm more of around the notion of getting folks a sense of empowerment. And that starts, as you know, with Let Us Make Man's model. If our people knew better, they would do better. And I know that you're gonna have some who are just gonna be, totally recalcitrant and just ain't gonna do the right thing. But we can't let that dissuade or discourage us from giving the people what they need. So in supporting the efforts that I do, one is I really want to empower folks by having them, one, take a breath and plan and strategize on what they can do from right where they sit, like in their house with their kids, focusing on sustainability and making good choices there. Then secondly, externally, just having the best resources that I can think of to address the problems that I foresee coming. So having those resources makes all the difference in terms of a person going into a depression and feeling a sense of empowerment. And then lastly, community forums where we can, as brothers who are still putting the information out in a broad landscape, try to collaborate, as Keith is mentioning, as best we can to support the on the ground efforts, but also push at the top for the collection of data so that we can get some of this money to help people in a more impactful way as this thing rolls on.
How can you let folks know how they can get connected with the Black Man Lab Resource Center so that as people have needs, you're always putting information out, but we just want to broaden the scope who you're able to touch.
Yeah, no, thank you, Brother Davis. Pardon me for not saying that first. Resources at theblackmanlab.org. Resources at theblackmanlab.org is where anyone within the sound of my voice can hit that email on issues that they are facing right now, principally education, housing, in this case, just resources around food security and jobs.
Thank you, brother. Brother Marty, you want to jump in?
Yeah, what I would like to pose a question to the panel, or one of the things that I think that we have to be real cognizant of is the need for us to be self-sustaining, right? Control the controllables. So when I say that, we know that there's a whole lot of outside forces that are challenging our communities. And one of the things that Brother Keith touched on in terms of how our communities are moving in a way that's not healthy. What can we do to make that happen? What can we do to get our folks better educated? What can we do to get them to see things in a way that's going to help our long-term health in terms of these kinds of epidemic sicknesses that are out there? I mean, there was plenty before the pandemic that's going on now. You talk about heart disease, you talk about diabetes, and so on. How can we better get the message right now as it relates to COVID, because so much is unknown? Brother Pee Wee, I'll bring you in first.
There's a term in public health called social marketing. It's when you get the community to kind of help build a marketing campaign for doing the right thing as it comes to health behaviors. And I think some of that is starting to happen. A lot of times that builds in our community from entertainers, well-known people, that kind of push and market the fact that we need to be behaving this particular way to get these positive health outcomes. So any way that the Black Man Lab can continue to be a part of that and help shape those social marketing opportunities. I mean, but it comes down to real need, though. I mean, some people, you know, for example, we're more vulnerable in terms of being frontline workers. We're disproportionately working in areas that we're going to be exposed to the virus. But we need to be able to market the fact that we need to be trying to keep our social distancing and not going and seeing family members. I saw where people are now doing the birthday drive-bys. I saw you do it, Brother Davis. We got to market doing the right behavior. I have a friend, just real quickly, I have a friend who's a city council person in the Atlanta Metro or commissioner in Atlanta Metro. And he threw a picture up with him next to a principal. And he was talking about how they were feeding the community. And I said, hey, man, the next time you throw a picture up like that, you need to have a mask on and you need to be 6 feet away from the person. Right. And he said, man, you're right, man. You know, in fact, that was an old picture I threw up. I said, well, you can't throw throwback pictures up and you showing that you feeding the community and you don't have the right stuff on and you have access to the right stuff. So it's that kind of mentality that we have to be very intentional about.
Thank you so much for that.
I want to jump. We have Dr. Claggett on. Vaughn, how are you, Doc? You're muted. Come on out. There you go.
Let's see here. Am I good?
You're good. You're good. We have. Thank you for joining. We've got Congressman Johnson on, who we're going to come to right after you finish up. But I just wanted you to introduce yourself and talk about some of the work that you've been doing. You've been ringing this bell, sounding the alarm for a minute. So we appreciate you, brother. I know you jumping from show to show and working in the hospital and doing the work. Talk a little bit about what you've seen, what you think we need to be doing as a community, and how we address this alarming death rate.
So greetings, brothers, and thanks for having me participate. This is a great venue, so I really appreciate it. So just a little bit about myself. I practice medicine. I've been practicing medicine for 27 years. Currently, I practice hospital-based medicine, internal medicine, which means that I deal directly with patients who have COVID and those types of diseases. I've been doing that for my entire career. Right now, I practice at Emory Midtown downtown in St. Joe's, Emory St. Joe's. So the good news about that is that I'm right in the city with Emory Midtown, so I see our people a lot. The other good thing about that is that I am on the front lines as it relates to all the available services that you would expect a first-rate academic healthcare system to be able to provide. I'm also able to see some of the inside data as it relates to comparing and contrasting different population groups. The other thing, I serve on the board of directors, the board of trustees for the University of Pittsburgh, so I see their response as well. But more importantly, or equally importantly, I serve on the board of directors at the University of Pittsburgh Medical Center, which is the largest academic healthcare system in the country, 43 hospitals, $20 billion in revenue. We're in 5 countries, so I really get an opportunity to see what's out there. So that being said, look, we're in the midst of a real pandemic that if we think if we think that we're going to have an easy road down moving forward, then we have deceived ourselves. As I told somebody, the cavalry's not coming right now, y'all. We don't have any medication that we know for fact is working. All of it is anecdotal at this point. There are some randomized trials that are going on. Hopefully we'll see something, but it doesn't look that there's anything right around the corner. As it relates to vaccines, there's a number of companies that are working on vaccines, but those vaccines are not going to be here anytime soon. So we are dealing with a disease that for the next several months, if not year, we're going to be fighting with. What we've seen effective up to this point is social distancing. We have absolutely seen the impact of social distancing. That is the only effective treatment prevention that we have right now. All right, and it is effective. The problem is that if you look at the people getting infected across the country and in this city, a disproportionate number of them look like us for a variety of reasons, which we're all talking about. But I'll give you all some numbers that are not official. So if you look at some of the hospitals, and I won't name the hospitals, we have anywhere from 50% to 80-some% of the diagnoses of COVID are people who look like us. So it's a disproportionately high number of people. And because we have comorbidities that other people don't have, and we have more of them. So we have not only hypertension, but we have hypertension and diabetes. We don't have only hypertension, we have hypertension, diabetes, and obesity. We have chronic lung disease. We know that we are disproportionately going to have a worse outcome than our counterparts. If you look at the data from China, a lot of our data came from China because they were added a lot earlier. If you look at the death rates there, the people who died, on average, they had 2.7 comorbidities. Hypertension, obesity, diabetes. How many Black folks have hypertension, diabetes, and obesity, or COPD, or asthma? So we are disproportionately we are steps behind everybody else at the starting line. Now add to that, that if the effective treatment up to this point or prevention is really social distancing, because that's really what it is, y'all. It's not hydroxychloroquine. It's not remdesivir. It's not Kaletra. It's not erythromycin, azithromycin. It's none of that stuff. I see it all the time. I don't see the difference. Now we'll wait for the studies to come out, and hopefully we'll see some effectiveness in it. If we know the effectiveness of social distancing, then the people most vulnerable for this disease are the people who cannot effectively social distance, which are people who look like us, who have to take in a disproportionately high number, take public transit, have to be on the front lines working jobs that put themselves at exposure. So we've got to do more. And then if we talk about the fact that we've got to figure out who has it so we can have them isolate, then that means we have to get testing. And that testing has to be in our community. It doesn't do any good to have that testing, say, at Georgia Tech, if our people don't live over at Georgia Tech and can't get there. So we have to make sure that testing is available in our community, education is available in our community, and the resources are there. And then the last point I'll make, and I'll be quiet, is we have to force the public sector, public sector and private sector, but to force them to show us the demographics on the disease. Show us who's getting infected. Show us who's dying. Show us what regions of the city or the state are being affected. A disproportionate number of people were affected in Dougherty County. That's people who look like us. So we have to ask them for that data, because if we have the data, we can make the argument of why the resources are needed in those areas. So I'll stop there.
Thank you, Doc. We appreciate you. I want to turn to Congressman Johnson. Congressman Johnson, you held a number of town hall meetings and other ways of raising awareness about COVID-19 and about what's happening in our community. What are some of the other initiatives, some of the other things that you think at the federal level can be done just from a health perspective? I know we're dealing with the finances of basically all of this unemployment, but what can we do? What do you see happening, Congressman Johnson, in terms of from a health perspective and the necessary resources in our community, as Dr. Vaughn Claggett has, suggested is necessary at this point? And you're still muted.
You sure? You sure it's me? Let me see.
You're good.
Am I good now?
Yep.
Okay. All right. Yeah, I think it was the doctor who said there's not going to be a savior that comes forward to save Black people from this dilemma that we face. That is certainly predictable, given the fact that we are starting out with compromised immune systems, weaker health, lack of access to the healthcare system, bias in the healthcare system, environmental racism, and those kinds of things. Those will persist. And now Congress has allocated $2.2 trillion in economic assistance to small businesses and large businesses and workers and families. But before we passed that CARES Act, we passed two other pieces of legislation back in March. And they had to do with strengthening the federal and state bureaucracies to be able to handle the money that we're putting in the pipeline, and also to state and local governments for purposes of delivering services, healthcare services, in addition to other services. So federal government has put a lot of money in, and we can condition future monies. We can condition future monies to state and local governments, providing that they must collect the necessary data that we need in order to address the disproportional deaths and the health outcomes that are coming towards our people. So that data having to do with testing, and by the way, funding for testing, and not just testing for those who doctors believe are in need of a test, but we need testing for anybody that feels like they want to get a test. And the tests should be free, and the treatment from those tests needs to be free. And all of that is already a part of federal law that has been passed. So along with that testing now, collecting the data on who's tested. And by the way, on testing, we need to go directly to the neighborhoods that are most severely impacted. So things like mobile testing are going to be in future bills that Congress considers. Sending testers to communities that are most at risk. And we know those communities are where the people work the jobs at the grocery stores. They are the bus drivers. They are the people who are working behind the scenes at the medical care facilities. They're at the nursing homes. They are doing all of these essential tasks, but they are not disposable. They are people who need to have the personal protective equipment, the gloves, the masks. And by the way, if you cannot afford to purchase a mask, or if no masks are available, you can make masks. You don't have to have a you don't have to have an N95 mask to protect you from this virus. You just need something to cover your nose and mouth to keep you from spreading it if you have it, and also to prevent you from picking up the droplets that are in the air from someone who might cough and has that virus. So it's very important that we wear masks, that we have gloves to protect us when we touch stuff. And when we do touch stuff, we need to be washing our hands. Now, things like that, there's no white knight in shining armor that's going to come along and save us from that. It's a matter of the information that we're getting. And there's a lot of misinformation out there that is being put on the Black community. First, it was this notion that Black folks were immune to the virus. That story is still circulating on social media, and people whose sources of information are relegated only to social media. And that, Black folks, if all we're getting is information on social media, and we're getting a lot of trash, a lot of junk information, a lot of information that is actually planted there to cause the result that we are talking about today. Until we can start moving ourselves away from misinformation and relying upon sources that are legitimate and credible, then we're going to be the ones who are persisting and walking around out there smoking. We're smoking cigarettes, we're smoking cigars and cigarillos and all of those things. We are obese. We're eating fried foods too much. We are eating fast foods too much. Those are things that we can do to help ourselves lose weight. I mean, obesity is a huge risk factor. So eating a healthier diet, even if we have to grow the vegetables in the garden out back. So there's so much that we can do to improve outcomes ourselves, but it's not going to be a magic bullet. It's going to take our efforts starting from this day forward, and we got to be in it for the long haul. And we need to come out of this crisis as a stronger community, not a weaker one.
Absolutely.
So Congressman, let me just add one more thing to you. When we talk about resource allocation, I think it's really important that this is a moving target and we have to shoot ahead of the target. So we're going to come out of this pandemic, hopefully a better country and a better community. But in order to do so, we have to anticipate where the opportunity is for us to be better. And as you go back to Washington, you may still be there, but when you go back to Washington, I would hope that you keep in mind the following with your colleagues. Telemedicine is going to be huge as it relates to how we interface between patients and providers moving forward. If there's one positive that came out of this, It is going to be the accessibility of patients to providers instantly or more conveniently through the use of telemedicine. Our community has to have access to that type of technology, which means that our families have to have computers or smart devices. Our physicians that are in our communities must have access funding-wise to telemedicine resources so that they can interface with people who look like us. And you're going to see a big push for telemedicine in the coming 12 months or 24 months. And we as a community cannot be left behind.
Thank you, Doc. I just want to jump to Keith real quick. Keith, do you, part of what we're hearing and part of what I think Congressman Johnson, I think, Dr. Claggett has shared, and Fred as well, is that the information and education that's happening at the local level. Because one of the challenges that I know my sons are having, and they're both college students, is they don't know who to believe. They as soon as they see the president of the United States, they just turn the TV off like he's lying. I can't trust anything that he says. And so our young people are in a space where they don't know who to trust, what information is good information. And I wanted to ask you, Keith, do you see people walking the blocks, passing out information, or walking with bullhorns, talking about, yo, here's what the real is on this situation, and here's why you need to be masked up, you need to be 6 feet away, why we need to try to build our immune systems through some of the immune boosting herbs and vitamins, and just work on our diet? Have you seen or heard that conversation when you're delivering these meals, Keith? And I'm asking you because I know you and Jermaine are just physically coming from delivering meals today.
Yeah, like when I was on the way to your house for the drive-by for your birthday thing, I saw a brother right on Candler Road across from South DeKalb. He was out there giving information. I didn't hear the whole context of it, but I did hear him speaking about Blacks and coronavirus. And then I have seen someone over in the West End kind of doing the same, because we're always coming from over at Clark's house here off Campbellton and going Lee Street and going through the AU Center to the where we're going. So there are a few spots where we're already traditionally known to be at, but definitely not to what I'm sure you kind of know needs to happen. It's definitely not structured. I think what the president has done is it just validates to everybody with some ill intentions that anybody can do something. You just got to see who you're gonna roll with. They feel like the president is just a big businessman, a big hustler, a big self-promoter, and it's gonna breed even more twisted psychology, I believe, in the next generation of people. Because to even see that as an example of our leader, man, it's just real disheartening. But for us, I think as Blacks, it just is, it's confirmation all day that this is, honestly not our country. We're honestly kind of not even really totally wanted here. I may be overspeaking, but I don't feel the like a embracing from the other side of the fence of this thing. So yeah, now the community isn't really disseminating any information. I think they still think it's a joke, and it's gonna take the next couple of weeks for those numbers to spike and a few more grandmothers. We know a friend who lost his mother the other day. My partner, his mother is Mayor Bottom's mother-in-law, and she's lost like 3 friends because they were over in that west, the one on the Cascade that had the senior citizens outbreak. I think like 80% of the people there had it. So I think we know that's safe to say everyone there has contracted it. But I have a friend that works inside of the hospitals. He has been showing this process for the past 4 weeks. And he told me 4 weeks ago, every single person I know is going to be contracted with it. He said it's just a matter of how their immune system can beat it. So I'm just thinking, man, we really need, we need the resources. When Dr. Karstoffen got us the funding, that was their whole niche, that we're providing more than meals. One, they're meals of dignity, but two, we're giving them wraparound service to help elevate people out of poverty. So for us to see America better, I mean, for me, it's to see the Black community have more sustainable ecosystems. That's basically what it is.
Thanks, brother Keith.
I've got it. Thanks, Keith. But Grant, I got to pull you in. We talk about self-determination, and it just feels like this is an example. We went down during the Katrina. We went down to New Orleans, went through Mississippi when Baba Chokwe Lumumba was alive, and we talked about the need for self-determination and how our folk, were being left. We had some community organizers load up and just go down and try to deliver food and physically rescue our people because the federal government was failing to do that. Briefly, and then I'll turn it back over to Brother Marty, just briefly around the issue of self-determination. What does this pandemic say to us, and what opportunity do you see it creating for us in terms of the psychology of people, of Black people, people of African descent being more self-determining and coming together to deal as a community or a nation within a nation?
I think, Mauli, it's a wake-up call back to self-reliance. We've had eco-communities that took care of each other before. And now we're recognizing that the federal government will not come save you. They're not a saving grace to what's occurring in our communities. We are our own saving grace. And so I live in South Fulton, and there's a farmer's market less than a mile from my house where 95% of all of their products come from Black farmers. And so they're doing a lot to contribute to and making sure that people in this community have healthy foods. I think some people were thinking the ideas that came out of the community were a little funny. I think somebody mentioned it earlier about having your own gardens inside of on your property, that our property should not just be about aesthetics, that it should also have some type of, we should be implementing some type of self-reliance on having our own herbal garden, having our own vegetable gardens, having our own fruit garden inside of our own property. So we're going to have to get back to doing some of the things that it's just not self-determination, that we rely and have interdependence on each other. As we do with the Black Man Lab, we recognize in our own community, and I think this is another very important point, that our doctors here, along with our herbalists and our naturopathic healers, I think our goals are different from other communities. And our goals typically with our doctors really want to be about healing. And I think that we've relied on somebody else's idea of healing or not healing and just being dependent upon drugs as opposed to doing something about healing our body. So self-reliance goes beyond just the community, goes what we have to offer in our own community. So the doctors that are on here, people are bringing back up Sebi again, but we have our own healers that have been doing a lot of healing. And I think there has to be some type of collaboration with our entire community, because it's a dynamic, there's some dynamic features that we all have to give some intelligence to on how we move forward and what's best for us. Because what's best for us, I think, is best for all of humanity. But if all of humanity doesn't want to do it, that's their own business. We have to do what's best for African people, and we're recognizing it right here, because we're the ones that are most endangered through this disease. And what Doc just said a little bit earlier, the distribution of resources is not coming into our hospitals. it's not coming into our hospital beds and things of that nature, because they don't see us having the issues or problems, or they're not thinking about those problems because of systemic racism anyway. So the way to go has always been self-reliance, self-determination. And then we're dependent upon each other. And then we step out to other communities globally but we should not be dependent upon global resources. We should be dependent upon our own interdependent resources.
Sure. Thank you, Brother Grant. Brother Pee Wee, I want to bring you back in real quick so that you can kind of give your feedback on that same topic matter. And then after that, I want to close out with Brother Ricky Jones.
Which part of that now?
In terms of the community base and what you're seeing for what's going to help us from a community standpoint. Again, what we don't have is that resource from the outside coming in. So we kind of need to be in a place where we're doing it ourselves in some form or fashion. And that's not just in terms of how we take care of our health, but also how we communicate with one another about what's going on.
Yeah. Again, I think it needs to be very intentional. We need to come up with very targeted ways in which we can social market the advantage of, basically saving our lives. And I think that needs to be a self-contained situation that we create among the masses we have in terms of our capabilities of doing that. It's critical that we model the way in terms of how we need to try to conduct ourselves, and that's everybody on the front line to our moms, or grandmas. Everybody's going to have to keep each other accountable as much as possible and model the way. I see Brother David putting his on. We got to model the way, and we just got to figure out a way to do I think we need to do a comprehensive plan to really social market us doing the right thing. We put billboards up for albums coming out in our neighborhoods.
Sure.
We do all these social campaigns. Let's do it for protecting and helping prevent this disease. As the good doctor mentioned earlier, the biggest weapon we have right now is social distancing. So we got to focus in on that, and we got to make social distancing cool in our community. If that sounds kind of trivial, but it's real.
Yeah, it's interesting. I just recently part of a group text. One of the guys is some guys that I used to play basketball with. One of the guys was talking about how they were fiending to get together to do what we used to do. And he said, well, maybe for a short period of time, we can get out and get to the park and do all this stuff. And I said, no. I said, the right thing to do is to do nothing, stay home, and make sure that we're getting well as a people so that when we come out of this, we'll be better for it. Brother Jones, can you give us some feedback? I know that you have had some very interesting dialogue with folks from a political standpoint, some of which has been very caustic conversations back and forth as it relates to Black people and white people interactions. What I would like to get from you is kind of what you've seen from that at this point. What have you heard? Have you had dialogue about folks from the other side talking about what is not really a disparity? Have you heard any of that?
No. Well, first off, when you say some of that dialogue is caustic, it's tense, it's overheated, it's negative. Look, it's always going to be that way when you talk specifically about the well-being of Black people.
Absolutely.
We're hearing a lot of this stuff, these buzzwords, in proper society now, at universities, corporations, diversity and inclusion. But quite often when you get down to these diversity and inclusion talks, they quite often do not include Black people. You'll have situations where a white woman is put in a position and an organization will say, well, we're being diverse and inclusive, but it's not including Black people. I think Brother Keith said something really, really important, man, that we have to consider when he said this is just really, and help me if I misquote you, brother. He said, this is another example that shows us that these people don't want us here anyway. And a lot of Black folk understand that who paying attention. If anybody is looking at what's going on with this coronavirus, and this is the moment that you figure out that America doesn't give a damn about Black people, then I don't know where the hell you've been. Right. I don't know where you've been. And so the question is this: when you talk about politics, you know, like Brother Jared, I'm a political scientist. And the best definition of politics that I've heard was it is the process that decides who gets what, when, where, and how. It's a question of how you distribute those resources, whether those resources be medical resources, economic resources, educational resources, all of these things. And so what Black people got to pay attention to, because we're really having two conversations. Before it's all said and done, this COVID-19, it's gonna pass, but Black suffering is still gonna be there, right? I mean, I'm a kid who grew up in Carver Home, so what Brother Keith is talking about, I grew up in that, just like you saw it on the south side of Chicago. That's still going on. Right now, we do not have, we don't have a social political agenda that speaks to Black people. We don't have that yet. And so what I think we got to do, and I've talked to Mauli about this, working neighborhood by neighborhood, city by city, and then linking up with one another to come up with some type of universal Black socio-political agenda. Stop depending on the Democratic Party, because they ain't gonna give it to us. And that's bottom line. So until we figure out a way to do that, then all we doing is blowing smoke, man. We just gonna be taking Band-Aids to situation after situation after situation, and still gonna lose at the end of the day. And so until we can really think and strategize on a larger national and even global level, we're gonna lose. Because, you know, I use this kind of as an allegory of the roach, and I'll close this out. You know, when O.J. Simpson was acquitted, this one white cat said, I was offended. We were offended by the jubilation of Black people. I didn't know they felt this way about us as white people. And I said, it's almost like if we sat down and had a conversation with roaches, right? And you ask roaches, man, how do you feel about human beings? And the roaches would say, we hate them. They've been killing us ever since we set foot here. You know how many family members I've lost to them? We come out at night just to try to get a little bit of food. We try to stay out of their way. They kill us then too. This country basically looks at Black people as roaches, a lesser species that can be disregarded, dismissed, and is expendable. And until we can shift how we approach that view of us, right? Not changing their view of what we do for ourselves, I think we're in trouble. So I think Brother Keith was right. So the question is now, what are we gonna do, not just in this situation, but moving forward past this situation as well?
Thank you, Brother Rick. That's on point, and I'm gonna reach to Brother Mauli right now. Mauli,
we had a couple just pop up.
Yeah, we're up against the clock, but I think we need to stretch it out a little bit, Mauli.
Yeah, we got a couple questions real quick from Brother Maurice Calhoun, who works with the DeKalb 100. Good brother. He raised a question: with Google and Apple developing a tracking system through our cell phones to identify and track infected people, how will this impact the Black community? Anybody want to speak to that as quickly as you can, and give us a 60-second, because we got another one right after that.
Corporate dictatorships, but somebody else can go on and answer that.
Doc, what are your thoughts? Are you familiar with this, Dr. Claggett? Are you familiar with the Google and Apple developing systems around being able to track?
Yeah. So, I heard about it. I don't know the full details of it. I mean, the idea in its broadest sense makes sense, right? That you want to be able to identify contacts of infected people. So we're talking about surveillance of disease or population management. So the concept itself makes sense. The question I have is the intrusion on privacy. Can the data be misused for other reasons? The tracking of individuals, the contact of one individual with another, the manipulation of of just corporate America. So, but the concept, I mean, it makes sense. I mean, if you want to figure out who you came in contact with and who could have been infected, you got to figure out how to do that. But I don't know if I'm willing to give up my individual rights of privacy for that degree of scrutiny by somebody else.
All right, we got another good question here for someone around the organizing spaces. Congressman Johnson, maybe you can help us, or Brother Parham, anyone. But the question is, where should we look? And this is coming from Eris Winger. What are the meeting spaces that we need to be thinking about to organize? So where are those? I guess we're now all in these virtual spaces. Where are those spaces where folks are looking to organize for sustainability, for self-determination, for our own protection? So anybody that jump on that.
Well, I would add.
You just
When
went
we
on
think
mute.
about,
Yeah, go ahead.
oh, I did. Can you hear me now? Oh, yeah. I was just saying, I would encourage the brother and everybody else really to focus in right where you stand inside your house and then next door. I mean, what we're really talking about when we're talking about organizing is creating a tipping point. I just started that audio book the other night in empowering our people. And what better way to create a tipping point is to go from one living room to the next living room until we have a concentration or a neighborhood who is putting out good information, who is demonstrating wherewithal and resourcefulness in helping our message and organizing right where they stand. And you can organize around the simplest thing. Brother Grant just mentioned the necessity of having a community garden. Who's got the biggest backyard? And so, or if I've got in my street or my neighborhood, I've found that I've got about 8 or 9 elementary school students. Well, who's most qualified to engage? It's just a matter of being very practical and learning the lessons of our past. Again, when we talk about building under this iron curtain of racism, we built and pushed this system forward with our imagination.
I appreciate it. There's a question from Paul Hobson. Paul, always at Black Man Lab live when we're together. But Paul, who's a school teacher, raises the question: what about partnerships? Have we seen any partnerships? And perhaps Congressman Johnson, you might have some insight on this. Have we seen any partnerships with the P. Diddy initiatives or Black Lives Matter or Me Too movements or the NAACP? Any of what we would consider national organizing entities, specifically organizing around COVID-19 to try to do work. So anyone that can answer that, Congressman or Rick Jones, whoever might have any insight into that.
I think we lost the Congressman Malley. Looks like.
Okay, come on in.
What was the key part of that question again, Mawuli?
Really, it sounds as if the different national organizations and what I would call formations, NAACP, Me Too movement, Black Lives Matter, P. Diddy initiatives, Jay-Z has initiatives. Do we see any coming together of those national organizations to engage in doing what you have suggested and creating a platform and educating community?
At the moment, I don't see any national cohesiveness with those organizations. And I'm not casting any aspersions saying that any of those organizations are doing bad work. I think they're all well-intentioned, but they're not necessarily, coalescing around anything with one another. We even see certain divisions among different chapters within individual organizations, right? So you don't have that cohesion either. I think it's really, really important, man. And I'm a political philosopher, and I used to be a hopeful idealist. I'm not necessarily in that place anymore, but I think it's really, really important that we be very, very honest with ourselves about where we are, right? what the challenges are that we're facing individually, that we're facing organizationally, that we're facing institutionally, that we're facing with the education of our children, where we are individually as far as our educational status goes ourselves, how we understand the world, how we are really working to link up our people, as brother said, going door to door, house to house, neighborhood to neighborhood, and what our deficits are. And if we can understand those things, then we can build. It's almost like hooping, right? And you got a strong right, a poor left, but you constantly using your right. If you never work on your left, then your game ain't going to advance. So I think we really have to pay attention to what our shortcomings are. And I think too, man, we've gotten way too comfortable with mediocrity too. This is an entertainment culture, and we cannot afford to constantly be obsessed with entertainment. We are entertaining ourselves to death. Look, man, I like music too, but I ain't necessarily trying to go to a musician if I need somebody to talk to me about education or history or political strategy. I mean, so if I need a lawyer, I'm going to come to you. I'm not going to play that role myself, even though I'm a political science major. So we got to really, really, really get away from that type of mediocrity and really get comfortable, not with criticism, but with constructive critique so that we can move forward, because we are literally dying out here. And I'll leave it at that.
And Maoli, can I add something in 20 seconds? We model that behavior here in the Atlanta community. And I say that because it's important so that other communities can do the same. So we're Black Man Lab, but we have tentacles with other organizations, with Let Us Make Man, with law firms. Anytime that we organize any type of event, we brought together not just individuals, but we brought together Black organizations that helped us facilitate those events, that movement, that idea. So I just want to speak to our own community here is doing a great job of, and we can always do better, a great job of facilitating some Black allegiances, some Pan-Africanism inside of our own network right here, our own social network and our own social Pan-Africanism by using the virtual and digital community.
And let me quickly say, brother Jared, I think you're right. For all of its shortcomings, right? I think Atlanta is really the tip of the spear for Black people. I don't think that you see a space in this country where Black folk are doing better at those type of collaborations and that type of proactive intentionality than Atlanta. Now, y'all, I'm from Atlanta, but y'all are living in Atlanta. So even with that cohesion that you're putting together, has it really knocked a dent in Black suffering in Atlanta? Oh, and Atlanta's doing the best that we're seeing right now. Atlanta better than New York, better than DC, better than LA, right? And so what have been the results in Atlanta? That shows you how massive this struggle is that we're facing.
I say.
And and we really appreciate you brothers for coming on and talking about, not just the death rate, because one of the concerns is always listening to our elders. One of the concerns from Baba Jihad was that this conversation was just going to be about conspiracy theories and things of that nature. And we always, with Black Man Lab, we want to deal with solutions. We have to have an analysis and a critique and an understanding that's grounded in historical, cultural roots. But at the same time, at the end of the day, we hope that the folks that have tuned in have had an opportunity to actually here's some solutions. Here's what you can do in your house, in your neighborhood. And then if you want to connect with Black Man Lab and with other organizations, we have to do that. And one of the challenges, and I'll say this, and then I'd like for us to close out. One of the challenges has been, even in Atlanta, is that we have lacked a code of conduct amongst those that consider themselves organizers and activists, that we've allowed for certain behaviors to be tolerated. And so versus us really doing the work because this is what we're called to do, people have used this as a platform for their own personal aggrandizement and for their own ego, and it's not a new thing. We've ego wasn't born in 2019, 2016. Ego's always been there. But I think as organizers, we have to say, here is what is permissible. Here's what we expect of one another. And if you violate this code, then there have to be some social, societal consequences that don't allow you to grab a microphone or jump back in front of our people and call yourself a leader. And so that's one of the challenges that I've experienced over the last several years that has really, I think frustrated some of the larger coalitions that we were building. It just, it's real. It's real. It's a real struggle. So we appreciate you, brothers. We're thankful. Brother Marty, thank you, brother, for your facilitation and leadership. And can you close us out as we link it up with a link in this chain, Brother Marty?
Absolutely, I sure can. Brothers, we're at the Black Man Lab Live at the end of every session. What we do is we link arms together in the tradition of a sister who was one of our ancestors that said, we're all links in this chain together. So I would ask everybody to put arms up like we're linked together, just as if we were together. And if you can follow with me, repeat it after me. I'm a link in this chain.
I'm a link in the chain.
And it won't break here.
And it won't break here.
And it won't break here.
I'm a link in this chain.
I'm a link in
This chain.
This chain.
And it won't break here.
And it
won't break here.
It won't break here.
We are links in this chain.
We
are links in this chain.
And it won't break here.
And it won't
break here.
Ashe.
Ashe.
Ashe. Thank you, brother, so much. Appreciate you. Appreciate your insight. Mildly, always, brother. Love what we're doing together, man. Let's keep pushing.
No doubt.
Bless y'all, brothers. Thank you all.
Peace.
Love y'all, brothers. Love y'all.
Peace and blessings, brothers.